Welcome to another episode from the Veterinary Research Channel. Today, we're delving into a recent study exploring the impact of surgical intervention on dogs suffering from a common and serious heart condition, myxomatous mitral valve disease. Myxomatous mitral valve disease is the most frequent cause of mitral regurgitation in our canine companions. As this condition progresses, it can become irreversible and eventually may not respond to standard medical treatments, leading to a poor outlook for the affected dogs.
Exactly. While pharmacotherapy plays a vital role, there comes a point where it might not be enough. This is where surgical intervention becomes a possibility for selected cases with severe mitral regurgitation. In human medicine, mitral valve repair is often preferred over replacement because it can better restore heart function, help prevent blood clots, and offer better long-term results. This approach is increasingly being used in veterinary medicine as well.
However, it's important to note that unlike in human medicine, there isn't yet a universal standard or set of guidelines for how to perform mitral valve repair in dogs. There are still questions about techniques, such as how to adjust the size of the valve annulus, how to determine the proper length for artificial chordae tendineae, and how best to monitor the valve both during and after surgery. To improve and standardize these techniques in canine patients, we need more information quantifying the effects of surgery on the mitral valve complex and the blood flow dynamics.
Precisely. Prior studies have looked at the mitral valve annulus geometry in sick dogs before surgery using echocardiography and correlated it with measurements taken during surgery. But there hasn't been much published data evaluating these effects after surgery in dogs.
And that brings us to the goals of this specific study. The researchers aim to evaluate several key aspects of surgical mitral valve repair in dogs with myxomatous mitral valve disease. First, they wanted to look at the immediate postoperative changes in the valve's shape and the creation of a proper coaptation area.
Yes, and second, they investigated how the surgery affects relevant hemodynamic parameters, heart size, and overall cardiac function. A third goal was to see if altering the hemodynamics could help relieve symptoms and reduce the need for medications.
Finally, they sought to gather information on the potential durability of the repair by following a group of affected dogs for 3 months after the surgery and looking for correlations between the pre- and postoperative echocardiographic measurements and the measurements taken during the operation. This retrospective study included 77 dogs diagnosed with stage C myxomatous mitral valve disease who underwent mitral valve repair using cardiopulmonary bypass. The dogs had their mitral valve geometry and cardiac function assessed using echocardiography before surgery, 1 week after, and 3 months after surgery.
Let's move on to what they found in the results section. Out of the 77 dogs included, the median age was about 10 years, and the median weight was relatively small, around 3.5 kilograms. The study population included a variety of small breeds, with Chihuahuas being the most common. Prior to surgery, all 77 dogs were receiving pimobendan. Almost all were receiving diuretics, and most were on other medications for congestive heart failure.
The surgical technique used in all cases involved an artificial chordal replacement and mitral annuloplasty. The annuloplasty involved shortening the parietal annulus until its area matched the size of the septal leaflet. Artificial chordae were then adjusted to ensure the leaflets met properly at the plane of the newly created mitral annulus. During the observation period, 3 dogs sadly passed away due to complications related to the surgery. However, the overall 3-month postoperative survival rate for the study was quite high at 96.1%.
A very important finding was related to pulmonary edema. Every dog had a history of acute pulmonary edema before surgery, which was under control at the time of the procedure. None of the dogs developed a recurrence of acute pulmonary edema after the mitral valve repair. Looking at medication use, the percentage of dogs receiving pimobendan was significantly lower at 3 months postoperatively compared to before surgery and even 1 week after surgery. Similarly, the ratios of dogs receiving diuretics and other heart medications also decreased significantly after surgery.
Now, focusing on the echocardiographic results, the coaptation length and forward stroke volume index were higher at both 1 week and 3 months postoperatively compared to before surgery. The coaptation length, which is the length where the valve leaflets meet and overlap, was essentially 0 millimeters before surgery, but increased significantly to a median of 8 millimeters at 1 week and 7 millimeters at 3 months. This creation of a coaptation area is a key sign of successful valve repair.
They also observed that the vertebral heart score, the left atrial to aortic ratio, and the peak velocity of early diastolic transmitral flow were lower after surgery. These parameters showed significant changes between 1 week and 3 months postoperatively, indicating continued improvement in heart size and filling pressures over time. Other parameters, such as systolic mitral annulus area normalized by body surface area, fractional shortening, and regurgitant volume index, were also lower postoperatively compared to before surgery, and these changes were already evident by 1 week with no further significant change at 3 months.
The study also looked at correlations between measurements taken during surgery and those taken with echocardiography. They found a strong correlation between the intraoperative mitral annulus diameter measured before repair and the diastolic mitral annulus area and circumference measured by echocardiography preoperatively.
And importantly, after the repaired intraoperative mitral annulus diameter also correlated strongly with the diastolic mitral annulus area and circumference measured by echocardiography at both 1 week and 3 months postoperatively. This suggests that echocardiography provides a reliable way to assess the changes in the mitral annulus geometry non-invasively.
Moving into the discussion, the researchers highlight that the creation of a cooptation area was the immediate and primary effect of the mitral valve repair. They propose that the cooptation length measurement is useful for assessing this area, which can be challenging to fully capture with standard two-dimensional echocardiography due to its three-dimensional nature. In this study, the repair technique essentially reduced the size of the mitral annulus and adjusted the artificial chordae to bring the leaflet cooptation plane level with the new annulus. This resulted in the previously prolapsed leaflets being properly positioned and contributing to the cooptation area.
The authors suggest that observing the cooptation length could potentially be informative regarding the durability of the repair, drawing parallels to findings in human medicine. Future studies could explore the optimal cooptation length needed in dogs by correlating it with factors like the reduction of mitral regurgitation, the incidence of postoperative complications, and long-term durability.
The echocardiographic findings confirmed that the mitral annulus area was reduced after repair, and the strong correlations with intraoperative measurements support the use of echocardiography for assessing the repair's effectiveness. The study identified that the repair technique had effects in 2 key directions, limiting leaflet motion in the vertical plane and reconstructing and stabilizing the annulus geometry in the horizontal plane. This two-dimensional approach, providing independent forces, is considered important for achieving a successful repair, similar to observations in human medicine.
The study's results also suggested that the compensatory changes the heart undergoes in response to mitral regurgitation, such as enlargement and functional alterations, started to reverse and normalize after the mitral valve repair, significantly reduced the regurgitation. Parameters directly affected by the repair, like mitral valve complex morphology and left ventricular blood flow indices, changed rapidly within 1 week postoperatively and then remained stable.
In contrast, indicators related to heart size and left atrial pressure, such as the left atrial to aortic ratio and vertebral heart score, also changed within 1 week but continued to show further improvement up to 3 months postoperatively. This suggests there's a delay between the immediate changes in valve geometry from the surgery and the subsequent recovery of some heart functions. This delay might be related to the time needed for the dog to recover from the surgery or adapt to the altered blood flow dynamics.
The study did observe a decrease in fractional shortening after surgery, which was associated with changes in the normalized left ventricular internal diameters. The authors note that in human medicine, a decrease in ejection fraction after surgery for degenerative mitral regurgitation is often seen, but it's primarily due to changes in preload and afterload rather than true impairment of the left ventricle's pumping function. Further research in veterinary medicine is needed to understand how a dog's condition before surgery and the invasiveness of the procedure might affect the outcome and the time required for functional recovery.
The study authors acknowledge some limitations. For example, they didn't specifically evaluate factors related to surgical invasiveness, which have been reported to influence postoperative recovery. Also, while they tried to measure cooptation length using only leaflet tissue, it could sometimes be hard to completely distinguish it from artificial or native chordae in some cases, although they found it generally feasible.
Additionally, this was a retrospective study, meaning that decisions regarding drug administration, dosages, and discontinuation after surgery were not standardized across all dogs. These decisions were left to the individual primary care veterinarians based on their assessment of the dog's improvement.
In conclusion, the study effectively demonstrated several key effects of mitral valve repair. It showed that the surgery successfully modified the valve's shape and created a crucial coaptation area as its primary effect.
It also confirmed that these changes led to improvements in important hemodynamic parameters, reductions in heart size, and positive alterations in cardiac function. Furthermore, the surgery helped relieve clinical symptoms and allowed for a reduction in the need for cardiac medications.
And finally, the study provided valuable data showing the strong correlations between the measurements taken during the surgery and those obtained through non-invasive echocardiography both before and after the repair.
Overall, this study provides valuable data for veterinary surgeons and cardiologists evaluating the effects of mitral valve repair and contributes to enhancing surgical techniques and patient management.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.